China has opened tens of thousands of fever clinics as it shifts gear to living with COVID after nearly 3 years of trying to stamp out the coronavirus.
全国2级以上医院开设发热门诊呢，超过了1.4万个；基层医疗卫生机构呢，设置发热门诊或者发热诊室呢，超过了3.3万个。同时呢，在增加发热门诊或者发热诊室数量的同时呢，我们也进一步的简化发热门诊的就诊的流程。
There are reports of staff shortages at hospitals in capital Beijing, while healthcare facilities have yet to be stretched to a breaking point. Some hospital staff have reportedly continued to work despite being infected with COVID-19. Some facilities have also cancelled non-emergency surgery to keep their services running. More than 2,000 new local infections have been detected in the last 24 hours. That's a slight drop from yesterday's count. Most of these infections are asymptomatic. Beijing has 50 severe cases, many of them with underlying conditions. Infections are also on the rise in the cities of Wuhan and Chengdu and in Hebei province. Those numbers may no longer reflect reality. China's top health body says the true scale of COVID-19 infections is now impossible to track due to reduced testing. And Lo Minmin joins us with more. Minmin, will the opening of these thousands of fever clinics help to alleviate the crunch on medical capacity?
The government is certainly moving very swiftly to address this problem of its limited healthcare capacity. But in Wuhan, for instance, some of these fever clinics had opened up for just a couple of days before shutting down again when their staff were infected with COVID-19. COVID is now spreading like wildfire in parts of China. In Beijing, for instance, on Saturday alone, 22,000 people were treated in its fever clinics, and that is a 16-fold jump from the total of the entire previous week. The doctor I spoke to told me that 2/3 of his colleagues are down with COVID-19. Some hospitals are battling to stay open no matter what, requiring their staff to continue working if they don't have a fever. Beijing's ambulance hotline has received 6 times the normal volume of calls, prompting authorities to tell people to stop calling that number unless it is a real emergency. The government now requires grassroots medical institutions to open up consultation hotlines so that there are more channels for people to direct their queries without going to the hospital.
Minmin, as you mentioned, clinics opening and then closing in a matter of days. In fact, the lifting of controls just a matter of days ago, just a few days ago, we're seeing zero COVID strictly still very much in place. How are people dealing with these very rapid changes?
Indeed, the changes are so sudden that it feels like whiplash for some people, because just over a week ago, you could get COVID-19 and be dragged into a quarantine center and cause your entire community to go into hard lockdown. Now you don't need a COVID test. And after 3 years of government messaging playing out the risk of long COVID, people are now hunkering down at home. They have either already gotten COVID-19 or are afraid of getting it. So if you walk around the downtown central shopping district in Beijing, you would see shops that are closed. The ones that are open are barely getting enough customers. And the only ones getting plenty of customers are the pharmacies. Medicines and rapid antigen test kits are out of stock. The government has acknowledged this shortage of supply and said they are doing everything they can to ensure there is sufficient supply.
需要自由承担的代价吧，感觉是，就是去各个地方方便了，但是就是对自己来说，自己要更严谨了，因为外面没有一个比较大的保护罩来防卫我们。
This is just the start of a huge COVID wave about to hit China. Experts say that 60% of the population could.
Thanks so much for all that. Lo Minmin speaking to us there.